Hello, and thank everybody for staying this late in the evening. My name is Dr. Patrick Treacy. I run a cosmetic dermatology practice in Ireland, in Dublin and Cork, and we have, I suppose, hair transplant centres around the world, in India, in the Middle East, and maybe in China also one day. So really what I'm looking at today is something that's very simple, that everybody can do and doesn't cost very much money and works. So that's always something that's good for both the doctors and the patients. I'd originally called it under the acronym the Dublin Lift, and it was peer reviewed in Prime magazine. So if we look at facial aging, we know that it's a consequence of two main things: extrinsic factors and intrinsic factors. And you could almost say the intrinsic factors are chronological aging, and the extrinsic factors are related to photoaging and UV radiation. So photoaging is going to cause pigmentation, fine wrinkles, skin cancer, thread veins, and chronoaging, which is, I suppose, aging by natural sort of aging, will give rise to skin laxity, wrinkles, epiphoria, and these. The face is the area that you know that most patients come to you in order to seek rejuvenation. And I suppose everybody to an extent is looking for a youthful appearance, both in males and females. Now, I suppose both photoaging and chronological aging, what they're basically working on is the fact that collagen disappears. And what we're looking for is means of treating collagen. And we all do it every day. One of my favorites, I suppose, is laser resurfacing. But we also use many other things. We use RF lasers, we use PRP, we use microneedling, microdermabrasion, and all of these methods are used to restore collagen in one form or another. And these are the sort of results we get. I would do a lot of laser resurfacing, and this would be a fairly typical patient with the histology. And laser resurfacing on its own has some positive effects. It will take away, I suppose, wrinkles. It'll take away pigmentation. It'll take away thread veins, even though it's not meant to do that. And I must admit, will give very good results. But the problem is that it doesn't deal with chronological aging. In other words, it doesn't deal with your nasolabial lines. It doesn't deal with malar fat pad loss. And it doesn't deal with cheek augmentation. And I had a lot of my patients that were, I suppose, getting good results for the photoaging, but not for the chronological aging. So technically, and of course you can get skin infections like herpes. So we do know that all of these things are just causing fibroblast stimulation with new collagen. And I suppose I asked myself, can we stimulate fibroblasts in some other way, and as a consequence also deal with the other parameters of nasolabial lines, of malar fat pad loss? And everybody, I presume, knows fibroblasts. Very interesting cell. They are often bipolar in terms of their nucleus. They also can form pseudopods, and they can move around different areas of the body. So if you can imagine, what we want to do is stimulate those and get them as many as possible. So we consider that these are the workers. If we're going to use something like growth factors, they're the bosses. And what we want to do is try and have the bosses there when all the fibroblasts are there. So if you just put in growth factors from PRP on their own, you'll get results that will last about 3 months. But if you stimulate the fibroblasts first, just even with a Dermaroller, it'll last as long as 6 to 9 months. I've done it. If you use a Dermaroller, the fibroblasts under an electron microscope begin to come together like this, and they'll grow across. They have got pseudopods, and as soon as you traumatize the skin, you will release factors that will make these growth factors move back and forward. Now, we know the different growth factors. How many people here do growth factors or PRP? Nobody? It's a very straightforward, simple technique, just one, and I suppose done properly can be very effective. So with PRP, you will have different growth factors that will start being produced in the environment. You'll get FGF, and that controls wound healing repair. You get TGF beta, and that will deal with cell differentiation. We'll have intrinsic growth factors also for collagen, and it will cause not only wound repair but regeneration of tissue. So that's something that doesn't cost that much money, and more we think that you may not even have to activate it. If you just pull somebody's blood, spin it in a centrifuge, take off the growth factors, and just dermaroll beforehand, particularly with hair and alopecia, it seems that that's enough to make it grow. Now, there haven't been great studies in this to date, and even though calcium chloride is used widely as the activator, it's quite possible that we're reaching a stage where there isn't good science on PRP at the moment. We're reaching a stage where a lot of people think that you may not even need an activator, really. So these are the different blood factors that come together. And red light. Does anybody use red light in the audience? This is another one you shouldn't underestimate. Believe it or not, this is some cells under an electron microscope, and if you watch it, this is a pulsing red light. And up here you've got an obstacle, and here is your fibroblast, and this is the fibroblast with the pseudopods. In other words, it can move. And if we move the light down to here, this fibroblast will jump over the obstacle to reach it, which is phenomenal, which means not only now can you stimulate fibroblasts, you can make them grow in volume with your PRP. So if you watch that fibroblast, up it goes and down it goes to move to the source of red light. So I ran a multi-center randomized study, 44 patients, and it's very difficult initially to do the three things together against nothing. So because I knew I had a lot of patients, cohort patients with laser resurfacing, what I decided to do was compare those two groups. In other words, I took 25 patients just getting PRP, fibroblast stimulation with Dermaroller, and also red light, and ran them against my patients. Now, the interesting thing is that when we ran the study, clinical assessment was done at 1 month and 3 months, and I decided to do both photoaging, and that would be the degree of reepithelialization, and also chronological aging. And there is a scale that we use called the Dover's study, and I suppose the higher your figure in it, the worse you are. So in other words, if you've got many fine lines, you score 4, and if you've got none, you score nothing, and if you've got severe facial veins, you score 4, and if you have no facial veins, you get nothing. So you can imagine the lower your score is, the better the effect of the results were. Now, also I put in some extra parameters, such as after laser resurfacing you can get pain, obviously, and they score negative. So these score positive and these score negative. So if you've got side effects such as crusting, plasma coming out, or severe pain, then the patient goes back up again. And the second means that I used was this thing called the Wrinkle Severity Rating Scale. And these would be fairly typical patients coming through this second technique, not the laser resurfacing. So you can imagine this patient here. Here's her eyes beforehand, and here's her after we done the PRP dermarolling and the red light. And you can see it's almost getting the same type of results as a carbon dioxide laser. This is a patient as well that sort of presented, and she would have had PRP. And the Wrinkle Severity Scale then works the other way. In other words, you score higher in terms of how bad you are, problem down the line. Now, the interesting thing is when we did the photo aging, when I compared one to the other, the laser was much better. I was a bit disappointed, actually, but I suppose in reflection, that's not surprising, because a few months later, the photo aging, I mean, that's what the laser is there for. But the interesting thing is when we did the chronological aging, the results changed completely. In terms of patient satisfaction, the patients were much, much happier up to about 3 or 4 months with the restoration of their volume, their male fat loss, the mid-cheek augmentation, because the laser doesn't do that sort of thing. But the interesting thing is that after about 3 months, the two things began to match up again, because the laser is comparing some level of chronological aging. If you've got skin laxity and it's sort of, your skin's falling down and then it's going to tighten that up, you're going to look younger. But the laser costs $2,000, €2,000 to do, but this other thing only costs like €20. So, I mean, you've got to be conscious sometimes. I mean, what are we doing? Is it for our own good, our monetary gain, for the benefit of patients? And you know yourself, particularly in China, where I get my Dermarollers from, you can get a Dermaroller for like €4. It doesn't cost anything to get blood from a patient, and it certainly costs nothing outside your nurse's time to inject it back into them. And you can get one of those red lights made in Hong Kong and China for about $5,000. And the only thing you have to be careful of the red light is the intensity of the fluence. It's the same as we use for his. Now, I did also a little test just to take the Dermaroller, the 633 light, the PRP on their own, and ran the tests on it. And I found that when I combined the three of them together, the effects lasted twice as long. And as well as that, the scores, some of them stayed the same, some of them went up, but with the combination, the patient satisfied was 87%. And I suppose it makes total sense. If you've got a situation where you're producing fibroblasts, then you want to control them to do something. So you're producing them through the Dermaroller and the microneedling. You're using growth factors to tell them what to do, and then the red light, if you put it on the face, will make sure that they all come up towards the surface rather than sort of, going down below. Thank you very much indeed, and I suppose that is in Prime Magazine as well.